Have you ever wondered how sex hormones impact health? Today, we're exploring sex hormones, their roles and clinical applications. By the end, you'll understand hormone modifications and their implications. Let's start with female sex hormones. First, estrogen is crucial for women's health. It's used in hormone replacement therapy for menopausal women. This therapy alleviates hot flashes and reduces osteoporosis risk. Next, estrogen helps in contraception. It prevents ovulation by inhibiting luteinizing hormone, LH, secretion. This steroid hormone acts on intranuclear receptors to influence bodily processes. However, estrogen therapy isn't without risks. Side effects can include increased blood coagulability, nausea, and gynecomastia in men. Women may experience weight gain, fluid retention, and hypertension. Now let's discuss progesterone. This hormone is essential in contraceptive methods. It prevents ovulation and supports pregnancy in assisted reproductive technologies. Progesterone works by thickening cervical mucus, which hinders sperm passage. It also interacts with intranuclear receptors to affect gene expression. Possible side effects include acne, breast tenderness, and weight fluctuations. Moving on, we'll cover male sex hormones. Androgens and anabolic steroids are key for male health. Androgens are used in hormone replacement therapy for men with deficiencies. This therapy enhances libido and helps with anemia. Anabolic steroids promote muscle recovery after surgery. These hormones activate nuclear receptors, driving muscle growth and other changes. Misuse of androgens can lead to aggression, hair loss, and gynecomastia. Long-term use may cause testicular atrophy and liver disease. Let's look at anti-sex hormones. Anti-estrogens are vital for treating specific medical conditions. They're used for estrogen-dependent cancers and managing osteoporosis. Anti-estrogens include SERMs and SERDs, which act as antagonists or promote receptor degradation. Aromatase inhibitors block estrogen synthesis from androgens. Side effects include menopausal symptoms like flushing and mood swings. Anti-androgens are also essential for managing excessive androgen levels. They are used in treating prostate cancer and conditions like polycystic ovary syndrome. Anti-androgens block receptors or inhibit testosterone production through various pathways. Watch for side effects like decreased libido, infertility, and impotence. In summary, understanding sex hormones and their antagonists is crucial in medicine. This knowledge helps healthcare providers tailor interventions effectively. If you enjoyed the video, hit like, subscribe, and click the bell to get notifications about new videos. As you apply this information, stay mindful of the implications for patient outcomes.